Good morning, everybody. Thank you for staying with us for this panel. I'm María Vilar, working at the Spanish Agency for Medicines and Medical Devices, and I'm here with my colleague.
So good morning, everyone. My name is Lucie Collineau. I work at ANSES, the French Food Safety Agency, and I'm co-leading the work package on surveillance, and especially the ESVET network for EMR surveillance in veterinary medicine.
Thank you. So we are going to have now an open dialogue with our stakeholders in the animal health sector. We will focus on AEMPS, IPC, and surveillance, as Lucie. And one of the objectives, if not the main objective, is to have an open dialogue with them and get their feedback, advice, and discussion on the implementation strategies we want to carry out within JAMRAI, but also trying to discuss about the potential synergies or the synergies we have between JAMRAI outputs and the actions they are carry out in their institutions. So with that, sorry. Yeah. and with that, we are welcoming our panelists to the stage. So we have Anna, Ernesto, Dora, and Clare. Please, welcome. And maybe we can sit. So we have Anna Mateus. She's a veterinarian by training, and she works as a senior scientific coordinator in the veterinary products and drug resistance at the World Organization for Animal Health, WOAH. She's responsible for providing the secretariat for the WOAH AMR working group, and is a technical focal point for the quadripartite joint secretariat on AMR. We also have Dora. She's also a veterinarian by training, and she works at the United Nations Regional Officer for Europe and Central Asia, based in Budapest, Hungary. And her current responsibilities at FAO include supporting projects at Eastern Europe and Central Asia that aid countries in developing and implementing their national action plans on AMR. Welcome.
And I'm introducing, it's my real pleasure to welcome Ernesto Liebana. He's also a veterinarian by training, and since 2007, he has worked at the European Food Safety Authority and is currently leading the biological hazards team. In addition, he was recently appointed as the lead of the interagency AMR working group, so he will also tell us more about the role of this group. So thanks, Ernesto, for being with us today. And our last panelist is Clare Carlisle. She leads the secretariat of the European Platform for the Responsible Use of Medicines in Animals, so-called EPRUMA. Clare is also the communication director at Animal Health Europe and communications lead on other multi-stakeholder platforms, including European Livestock Voice and Pet Islands Europe. So thank you, Clare, for being with us.
So let's start with our first question to Dora, and it's about how the JAMRAI outputs we are producing in animal health sector can complement FAO activities to tackle AMR.
Well, thank you very much for the question. And also I'd like to start with saying thank you for the organizers for inviting me to join this panel, but also to be part of this meeting. I can say that it has been very inspiring to listening to all the talks and to see all the achievements of the EU-JAMRAI. There are really, really great achievements, so I really enjoyed being here. And so for the purpose to answer your question, I need to give you a little bit of background of what we are doing at FAO. I hope you don't mind. So at FAO, we are particularly working in low and middle income countries all over the world. But I am representing today the Regional Office for Europe and Central Asia. And from this office, we are working, as it was mentioned, particularly in Eastern Europe and Central Asia and the Caucasus. And when it comes to the field of AMR, we are supporting countries in developing and implementing their national action plans on AMR, focusing on the actors in the food and agriculture sector. So we are mainly collaborating with the animal health and food safety and plant health authorities, the farmers, the veterinarians, and also the animal health laboratories. So they are the main counterparts that we are working within the countries. And we are working with them in various aspects of antimicrobial resistance. So we are trying to build capacity in these countries for them to conduct AMR surveillance. We are also providing trainings for the veterinarians and the farmers on prudent antimicrobial use, but also on other good practices that can help to reduce the need for antimicrobials. We are also working with veterinary faculties in the region to improve the curriculum of veterinary students. Yeah, and we are also doing a lot of awareness raising. So these are our activities in a nutshell. And I can say that the EU countries always serve as a best practice example in our work. So whenever we are providing trainings and giving advices to the countries, we always follow the EU guidance and the EU examples, and it is very useful, especially for those countries in the region that are aiming to become part of the EU. And for some concrete examples, as I was listening to the talks in the last few days, I'd like to highlight two things that I found really, really interesting and also particularly useful in our work. One was the country examples about the activities to improve the accessibility of antibiotics. I really liked these practical examples and the approaches that you had. So this is for sure something that we will also use in our work, because the accessibility of drugs is also an issue in our countries. And then the other thing, I am really looking forward to see the antimicrobial stewardship guidelines for the veterinary sector that you were mentioning yesterday, that are going to be published quite soon, because I'm pretty sure these will also be very helpful for our counterparts. Of course, they may need to be adapted to our context and to our country's context, but I'm sure we have a lot of overlapping issues. So yeah, I will not take more time. Thank you.
Thank you, and I think we are all expecting to have this collaboration with you. And our next question is to Anna, and it's a similar question, but what synergies do you see between WOAH strategy and on AMR and prudent use antimicrobials and JAMRAI deliverables we are producing?
Oh, thank you so much. Okay, I'm starting. I do a collection. I always have this issue. But thank you so much for the opportunity and for me to be here today on behalf of the World Organization for Animal Health. We really are following very closely what JAMRAI is doing, because it's so inspiring and so motivating to see the deliverables that you're preparing, and the progress since last year's meeting has been amazing. And I was only here yesterday, but I was really impressed. So I can see a lot of synergies between what the deliverables of JAMRAI and also our AMR strategy. As just a reminder, WOAH is an intergovernmental organization, and we are responsible for setting up the international standards for animal health and welfare. And we have 183 members across 5 regions. So actually there's the opportunity for globalization and increasing the impact of the reach out of your deliverables. Actually is very well aligned with our 4 pillars of our AMR strategy. So our first one is on raising awareness and understanding of AMR. I think the work, for instance, that your comms team is doing is amazing. We first had the launch of the video for veterinary services, our general session last year. And it went into the veterinary services, but also the chief veterinary officers that are at the general session. And they were really impressed, and everybody wanted the pin. So we made everybody wear the pin. And then we went last year, we also went to Brazil. So during the summer, with the comms team and the World Small Animal Veterinary Association, we developed the videos and the postcards with the pin for the Congress in Rio de Janeiro in Brazil. And this was really aligning it with our own standards, but also with VSAVA's recommendations for veterinarians in practice. And working with companion animals is really a different ballgame because they're not covered by veterinary services and it's all private sector. So it's really difficult for us, and you have also the pet owners. So it's a totally different ballgame because we're also dealing with vaccine hesitancy and people having very odd beliefs and behaviors. So in that Congress, we reached out we had 5,000 veterinary staff and private stakeholders working in companion animals. And we distributed, this was a pilot, so we distributed 2,000 pins and materials and the videos between us and VSAVA. So it was quite impressive, and people were so recognizing and so happy to have materials to disseminate to pet owners because they're seeing a lot of antimicrobial resistance in the Americas region, particularly in South America and Central America, but they don't have the resources or the tools to educate companion animals. They see a lot of bad behaviors like getting antimicrobials without with the prescription of veterinarians, and they are dealing with a lot of multi-drug resistance and off-label use of carbapenems and other highest priority critically important antimicrobials. So that's one, and we continue to work with the comms team because this is a great collaboration. At the same time, we are also working on doing antimicrobial stewardship concept. So our working group has come up with a definition for consideration, but of course it's not adopted by our members yet, but we would like to, we have raised it as well with you, and is thinking about antimicrobial stewardship as the commitment for preserving antimicrobial effectiveness by creating and sustaining conditions where antimicrobials are not needed and where use is necessary, optimizing use to ensure maximum effectiveness when you have to use them, and reducing the risk for resistance within a culture of continuous improvement. So we're really looking forward for your guidance on antimicrobial stewardship, because then we can try and see how we can continue to work towards antimicrobial stewardship concept, developing that together with you, so we don't duplicate the work and we don't confuse our membership. Because we already have differences between regions and we need to make sure that we all align. So, or else the membership doesn't uptake the recommendations. It's really a problem. And I think that would be great to have that. And we're also focusing on disease prevention and control, for which we're also looking very, very much to your IPC and biosecurity measures. WOAH has a list of priority diseases that we're currently revising to try and improve the uptake of vaccines. This was following the Animal Health Forum that we had at the last general session, but also following the UNGA political declaration for antimicrobial resistance that came out in September 2024. And also very importantly, I would like to say that we, from our ANEMUS data, which is from our global antimicrobial use database for animals, we know that having training for biosecurity actually helps reduce antimicrobial use. So if we have the evidence, the data, we can actually see the impact of the interventions. So we have that for New Caledonia. They did training for biosecurity against African swine fever for the outbreaks that are going on globally. And actually the side effect of it was a reduction of 44% on use of medicated feed in pigs. So they were really happy, so we have that kind of thing. So we're trying to get as much case success stories from our membership to try and show the evidence, because the problem is, like yesterday the key speech was done, is we need more evidence from the animal health sector to make sure that then everybody sees it. And we have that issue at the moment. The human health, they have that evidence from the GRAM study, but we're missing that. And that leads me to the ears vet, which I think is really important, because that will help us to have an idea of the burden of animal disease associated to antimicrobial resistance. We really, and particularly related to animal pathogens, we really need that evidence to be able to convince politicians. And it's very aligned with our standards. We currently revising Chapter 6.8 of the Terrestrial Animal Health Code, which is focused on harmonization of surveillance in antimicrobial resistance in animals. And we need to be able to harmonize the data between our sectors, because there's a lack of that, but also to be able to compare what other sectors are doing, and then across countries as well. So we really need that data, and we really look forward to see what's coming out from your project. So thank you so much.
Thank you, Anna, for very explaining a lot of things in common and where we can collaborate. So our next question is now to Clare, and it's about how can EPRUMA use JAMRAI outputs on AMS and IPC frameworks or guidelines to enhance the optimal use of antimicrobials. And I pass.
Thank you. My feelings of imposter syndrome are raging right now, because not only am I not a veterinarian, but I imagine that many of you have never heard of EPRUMA. So I'll just start by explaining what EPRUMA is. So it's a platform, a multi-stakeholder platform that was set up in 2005 by Animal Health Europe, the association that I work for as the day job, so that's the veterinary medicines producers, FVE, who I know is here in the room, the veterinarians, and Copa Cogeca, so the farmers and agri-cooperatives. And it was based on an existing platform that was set up in the UK called RUMA, and they focused on responsible use of medicines in agriculture only. We wanted to look wider at the use of medicines in animals in general. And we quickly grew to have, I can't remember how many it is off the top of my head, but I think it's 12 members. So we include also producers of diagnostics, the biosecurity people, the breeders, the feed people, the small animal vets, and many more, I'm sure. And we also have associate partners in national platforms. And so within our network, I think what we can do, certainly with the JAMRAI outputs, is really spread that within our networks, because we have direct access to the veterinary associations, to the farmer associations, so directly to the people on the ground who are prescribing antibiotics and using antibiotics. This is something that we do on a regular basis. We've always supported projects such as Innovad, such as Disarm, Project Roadmap. There have been so many over the years since we first started. And it's something that we do very often. So EPRUMA is a member of the EU One Health platform on AMR. So we attend those meetings, and again, we will raise awareness on the outputs of JAMRAI, on our own work through the years as well. But in a second instance, at a meeting last week of our partners, we agreed that the best practice framework that we set up, so EPRUMA has its own best practice frameworks, which is not really about, well, it is about stewardship in the sense of setting the scene for responsible use of medicines. So we have guidelines for antibiotics, anthelmintics, vaccines, and then more recently we have parasite control products in pets. We also have fact sheets on responsible disposal of medicines, and we're currently working on fact sheets on biosecurity and on online sales, so how to identify if it's a valid seller of antibiotics and the need for a prescription. But we don't only focus on antibiotics, as you've heard here, so we really want to make it a very holistic program, and we are going to be reviewing our best practice framework, so definitely the outputs from JAMRAI will serve for that. We will definitely look at those. We need to update it in line with Regulation 2019-6 on veterinary medicines, so that is quite a mammoth task, but it's something that we'll be taking on this year. But one thing I will say, as you heard me mention, we have recently developed guidelines on parasiticide use in pets. We don't have guidelines, we don't have any best practice framework for antibiotic use in pets. We have, over the years, done some minor communications on, responsible use, responsible disposal of antibiotics in pets, but we don't have a sort of set framework for that. So that's something certainly we can glean from the JAMRAI outputs. But for us, surveillance and data are also very critical issues. So we were really pleased to hear earlier this week that the EARSvet report will soon be published. So this is typically something that we will pick up, glean some key information from that and share via our networks. And I know there were questions about the sustainability of that, so I would make a plea to our commission people who are looking at their computers to please give the mandate to EFSA for that. We fully agree that this would be a good body to take over the ear sweat, so hint, hint. And then just, there are other work packages, of course, that are important for EPRUMA, for particularly on access. So over the years, EPRUMA, it's a communications and a policy platform. So we get involved in the consultations on EU regulations, on policy, particularly a couple of years ago on the priority list for antimicrobials, because for us it was important that animals retained access to the key antibiotics that they still need. Of course, human health is a priority, but animals, need access to medicines too. So that's definitely a work package that we're also very much interested in, because we need to make sure that we can continue to bring veterinary medicines to market and, of course, increase access to vaccines to increase the prevention side of things.
Okay, thank you. Now let's go to ask for more practical advice from you. And I would like to ask Dora about what factors you think will make IPC and AEMPS an effective instrument rather than a constraint in the future of farms and veterinary medicine. I'm talking about sustainability of that implementation.
Thank you. It's difficult to say something that hasn't been said already in the past 2 days. So I'm going to highlight first 2 things that I think are really important, but has been mentioned, of course, in the past speeches. One is, I think, is the economic aspect of the intervention. So for the farmers, livestock farming is the income. So whatever we try to make them do, I think it's very important to show them that these will also come with an economic benefit. So we need to show them that if they improve IPC practices, if they improve husbandry practices, nutrition, they can eventually improve productivity, and they can reduce the use of antimicrobials, they can save some costs there, so at the end it can be beneficial for their how to say it, let's say for their business, let's say. So I think it's really important, and the government, the support of the government, different funds and incentives can be very useful in this aspect. Another thing I think is really important and has been already said is integrating behavioral science approaches into the interventions that we design to improve IPC and antimicrobial stewardship practices, and really to try to understand what are the factors that are influencing the behaviors that we would like to change. Like, just to give an example from the countries where we work with, it is very common that the farmers can and do buy antibiotics without a prescription from the veterinarians. And we all know that it's an issue, but in many cases this is not because of they don't know that they should consult a vet, or they don't want to consult a vet, or there are no regulations that they need to have a prescription, but instead it comes from the difficulty to access veterinary services in some remote rural areas. So this is a problem that we cannot simply solve by educating the farmers, because the problem might not be that they don't know what they should be doing ideally, but instead we need to look at it at a broader context. And the third point that I'd like to make very briefly is about focusing on also the young people. So not only the farmers and the veterinarians, but also the undergraduate students, like the undergraduate veterinary students, to kind of shift their mindset to already start practicing with these new, let's say, new trends in their mind, and so that IPC and antimicrobial stewardship is really integrated in how they start to work as a veterinarian from the very first day after graduation. And I believe that if they graduate from veterinary school with that mindset, it can be really helpful to make these interventions work and be sustainable on the long run. Thanks.
Great, thank you. Following up that question, we would like to hear from WOAH how you can complement also this question about sustainability of implementation, like which are the incentives or enable conditions from your point of view that most effectively can support implementation of EU-JAMRAI produced frameworks.
Thank you so much for your question. That's really interesting. So similar to FAO, first we need to have the buy-in from politicians. And I'm not only saying European Commission, but it's really very important to have that AMR prioritized in the political agenda. Everybody is very distracted at the moment because we are facing very complicated geopolitical situations globally, and we need to make sure. So we have the EU region as being one of the leaders in AMR because there's really a buy-in from the European Union, the community, to deal with it, and it's been shown for many years. And time again, the EU has proven that it's committed to lead by example. And it's not only JAMRAI, for us, also we have had received funding from the EU to do projects in the Americas region from several countries, and also in the Asian Pacific region, we just finished a large project. So now we are gathering also funding to try and continue these activities that we first started. It's like the planting seed for us to start doing more and more work with AMR in the regions, particularly because in many of these regions, there are hotspots for AMR, and we cannot think that we are living in a contained region. We have international travel, we have international movement of people and animals and food, and therefore we need always to be thinking about this as a global issue, not just a regional issue. And when we think, for instance, at the quadripartite data from TRACS, which is the self-assessment that countries have to do in terms of monitoring the implementation of the national action plans, we have 177 members across the 4 organizations that say that they have multi-sectoral national action plans, but actually only 20% of those are actually putting funding for the implementation of the national action plans. So it looks nice in paper, but it's not really going very far away. And usually the issue is also saying there's no action. There's the national action plan, but there's no really action there. So that's what we have. So that means then that any frameworks that you have on IPC or antimicrobial stewardship are not being implemented. And we're not seeing any results, and the issues remain. So it's really important as well, as was said before, that we need to have a kind of assessment of the impact of interventions, but it's not only in terms of reduction of antimicrobial use, but also in terms of animal health indicators, impacts, welfare, and then also economic impact, because that's very important for members. How is that going to affect our livelihoods of farmers, as Zefia was mentioned, but also the GDP, and the productivity, and the international trade opportunities. That's also very important. So one of the things that we're trying to say is, for instance, that we should be working and looking as well for potential funders that are not always public, but also considering private sector as resource partners, and also establishing public-private partnerships to see how we can collaborate together, explore the synergies, because, for instance, there's a lot of large companies that have integrated production systems that can lead by example. And for instance, on the veterinary sector and companion animals, we see that we have more global corporate veterinary practices that also have IPC, they also have antimicrobial stewardship, and they also have their own programs. So it's important that we ensure that because they can help us also to implement in the field these kind of practices. So we have the veterinary services and then all the private sector we have to address. And then, of course, we need also to do campaigns for awareness, not only targeting the usual suspects, which are veterinarians, veterinary services, but also animal owners, children at school age, or undergraduates across human medicine, veterinary medicine. And I really love what you've done with arts, like the exhibition last night, because it's a different way of reaching out. And I know probably the youth group, for instance, from the quadripartite, they do a lot of activities. There's things about doing media. For instance, I'm totally useless in TikTok videos, but apparently that's the big thing in many countries. So that's how things are trying to move at the moment. And we also, very important to make sure that, that we can doing I mentioned before the complicated geopolitical situation, but we have the UNGA political declaration. And 193 UN members have signed it. So we really need to build on that. And I think your deliverables are very aligned with those, because for the general commitments, but also for the 4 main specific for animal health, which are mainly reduction of antimicrobial use in food production systems, the other one, optimization of antimicrobial use in animals and agriculture. We have also a big focus on disease prevention, and as well, improving access to quality veterinary services, but also quality medicines that are affordable and are quality. And from the medicines, you have not only antimicrobials, you have also other veterinary products like alternatives to antimicrobials, vaccines, and diagnostics, because we tend to miss that you cannot do a good antimicrobial selection or treatment selection if you don't have good diagnostics available. And I'll stop there. Thank you so much.
Thank you. You have been giving us a very nice overview of what is needed, both of you, from FAO and WOAH point of view. Let's move to Clare, and I would like to ask her how we can work together to ensure that the stewardship and responsible use of antibiotics is administered through those using veterinary antibiotics. Thank you.
Yes, thank you. So indeed, as I mentioned, as a multi-stakeholder platform, obviously we have access to a wide network of those who are directly prescribing and using the antibiotics. So all of the outputs, everything can be converted by us into messaging when we're speaking to those people, particularly the farming groups. There are many trainings adapted nationally for farmers on responsible use of antibiotics, on holistic animal care, so there's a reduced need for antibiotics. And I would like to call out in particular one, it's not under the EPRUMA umbrella, but it's run by FEE right now. So they are running training sessions for farmers and veterinarians together in all of the member states. So raising awareness, training on AMR, training on the application of the new rules on veterinary medicines, and this is absolutely crucial. This is something that I think we should all be doing, and I understand that it requires a lot of financing, a lot of budget, but this is how we get the message to those people on the ground, you know, who need to know more about responsible use of antibiotics. But on top of that, I mentioned the national platforms that we have as associate members. Now, 2 of these are from the UK, but we also have Belgium. I saw AMCRA here in the room, and we have the Netherlands and Spain, and they are extremely active on using the outputs from these different programs and converting them into training sessions, into awareness campaigns. I mean, I was really gobsmacked by the fact that this little pin is being picked up by the BBC. I said to the comms people, this is such an achievement. As a comms person myself, when I saw this campaign launching for the symbol, I was like, oh, that's a really nice idea. I hope it takes off. And now we're seeing, I saw Emmanuel Souberan wearing it. I've seen, you know, all the leaders of these associations wearing this pin. And this is exactly, if that's the only thing that comes out of JAMRAI, then, you know, that's a huge achievement. We want that to be as well known as the AIDS ribbon, as was said yesterday. So that's definitely something that we can help. Our purpose is to serve as a multiplier. So my message to JAMRAI would be, please use us. We are obviously on the stakeholder group, so please use us. Please ensure that we get all the materials that you're producing. And then also, you know, we are direct members via FEE, via Access VetMed as well. So we're very much involved in the co-creation in some of the work packages. And I think this is really important. The fact that we created guidelines, a best practice framework together with the farmers and the veterinarians means that it's actually applicable on the field, so to speak. So it really is something that they can use, because obviously policy is great, and I think we do need to have rules, and it's great that we now have prescription EU-wide. But it does have to be applicable, it does have to be feasible. Those of you who live in Brussels or Strasbourg or even other countries will have seen farmers out in the street protesting because they are overburdened with admin stuff. They feel that they're always blamed for destroying the planet, and they have had fingers pointed at them for overusing antibiotics as well. So we need to produce positive communications, guide them, help with financing. We're hearing that the cap is, being reduced. So all of these things need to be taken into account. It's not just about guidelines, as the medical doctor said earlier. It really is, we have to help those, give them access to the human resources that they need, to the financing that they need, to veterinary capacity. We have a lack of veterinarians, particularly large animal veterinarians, and this is something that needs to be seriously looked at, especially as we are going to a more preparedness approach in the EU. Animal health is part of that preparedness, and disease prevention is a key part of that preparedness.
Okay, thank you for your input. So I pass the word to
Yeah, thanks.
Lucie.
I will continue and help out as well. So during this General Assembly, we also provided an update on our progress with developing ESVET, which is a network for AMR surveillance in animal pathogens. So my question goes to Ernesto. In your view, Ernesto, could you share with us your ideas on how you think ESVET could complement and be integrated in the future in the ecosystem of existing AMR surveillance programs in Europe, including the one run by EFSA?
Thank you, Lucie, and hello, everybody. I would like to say two quick things before jumping into the question. The first one is I'm really grateful for JAMRAI to have invited EFSA again to this stakeholder forum for the second time. I was not so happy in JAMRAI 1, and I made a couple of points because I didn't really see the One Health other than in the title. I see that there has been a massive change in mentality, a huge jump in efforts, and I truly believe that this is now working. I think all the environmental compartment activities, what you have done with ESVET is really commendable. So I can see that that this is really a good thing. Then, because I represent EFSA, and EFSA has in its title Food Safety Authority, it's not immediately evident for people that we also have a mandate on animal health. And there is an animal health and welfare panel that provides a lot of advice to the risk managers in Europe. But this has been traditionally on the topics different from AMR. And I think the history of advice on AMR and animal health is very short. I can go back around 10 years when, together with our colleagues in EMA, we produced what for us is the Bible, this RONAFA report. It took us over a year, and it ended up with very concrete and nice recommendations around three topics: reducing, replacing, and rethinking. Reducing the use of antimicrobials in animals, and it was basically by bringing very prominently this issue of setting targets. Then the targets went into European legislation, and we are progressing very well in the animal sector towards meeting the targets in reduction. The rethinking, which has always been, the replacing, that has always been a challenge, and in which EFSA is also quite often involved. We are the recipients of applications for new feed additives, and companies are very interested, but it's not so simple for them to understand how to make it possible. And then the rethinking is where, especially in the animal welfare area, this AHAO panel that I mentioned has done a massive amount of work to try to improve the way our animals are treated and raised so that they need less antibiotics in their production systems. So that was the first thing that was done in this front. Then, more recently, we received a number of mandates from Santé. One was to come up with priority combinations of animal pathogens and antimicrobials, and that was quite successful. There was an opinion for each major species and also for pets, and I think that has been picked up by also ESVET in considering what should be surveyed for. But then there was a second question, and it was about applying the criteria which are listed in the animal health law to see if any of those combinations would make it to the list that mandates the performance of EU-wide surveillance. And the answer to that was in most cases uncertain, meaning that there was no good reason for the risk managers to add this to that list. And that was the end of the story. So I think in your question, I have to separate what is scientifically interesting, and you explained it very well when you did the update the first day of the meeting on EARSVET. I think it's quite clearly there is a gap. We don't have data from sick animals. We don't have data at the European level in a harmonized way for pets. And this is something that would be immensely helpful when you're trying to do antimicrobial guidelines, when you're trying to correlate the level of use with the impact on seeing how this reduction also has a positive influence in seeing less resistant pathogens. We do it with a proxy, which are our indicator E. coli, and that is showing already that the progress is there, but it would be very nice also to have the indication that this is truly happening with the bacteria which are making animals sick. And therefore, in my view, really important also if you want to monitor any type of intervention directly, because otherwise you're always linked to a proxy. So as you heard, EFSA is very active and 4 years has been coordinating in Europe the production of this One Health AMR summary report, which gathers data from healthy animals and from food-borne pathogens such as Salmonella, Campylobacter, E. coli, and these are very useful data, and they are. It comes from the mandatory activities of the zoonosis directive. So there is a very clear written law that makes member states to perform this monitoring, to send the data to EFSA and end up in a report which is totally transparent and allows comparisons between countries, between sectors, and that puts a bit of peer pressure, and I think is what makes people and countries improve. So it would be a dream to end up in a situation where you would close all these gaps and end up in a complete report, or in reports which are complementary and in turn can be used also, all this data, in the comparisons that we do, the correlation analysis done in JACRA with our colleagues in the human sector. So there's no doubt that scientifically this is important and relevant. Then is what is feasible and what is prioritized. That is a bit out of the hands of EFSA. It is something that we often say, and sometimes you produce scientific advice, but there are many other considerations that need to be brought into the discussion with member states and with risk managers. And we all know there are conflicting priorities and resources are limited, so there's no money for everything. I think it's highly unlikely that the animal health law will change. So my advice would be to look into other ways of first proving principle that the EARSVET report is important and convincing people that the data there can be used and have a positive impact. And then perhaps think of a way of starting via voluntary programs, I don't know, by selecting perhaps specific combinations and proposing EU baseline surveys on particular combinations, things which may sound not too ambitious, but that I think step by step will help. And who knows, maybe in some years' time, we will be in a position to receive a mandate from our risk managers in EFSA and make this possible. In saying that, I also want to say that, of course, any data that comes from any reputable source, let it be scientific publications, reports produced by national competent authorities, all this data is used by EFSA in the risk assessment. So even if we're not in the lead of producing those or gathering those, we will be users of the data for sure. And I think, as I said, with time, with evidence, we can convince people of how important that is. And I think I would stop there. Yeah.
Excellent. Thank. So this question is about, this session is about, animal health activities in the field of IPC, AMS, and surveillance. But you had another session on human activities, and we have one on environmental activities. But we say, okay, we need also to work across sector, and this is what JAMRAI is about. It's also a question we wanted to ask to Ernesto, because he was recently appointed like the head of a new European interagency AMR working group, which role is a bit to facilitate this link across sectors that we're trying to emphasize and build here in JAMRAI. So Ernesto, maybe to inspire the way we are working here also in JAMRAI, could you explain us a little bit more about the nature of this interagency working group and what are the scope and the mandate that you are trying to achieve? Thank you.
Sure, thank you. And yes, my role is a bit less pretentious as the one you mentioned. I'm just the chair of that group for the first 18 months. It's a new group, and I have to thank also our colleagues from A1, One Health Sante. I think it came from the Council recommendations, and it was obvious that we needed to have all the right partners around the table in discussing also at agency level. We have a long history of collaborating with ECDC and with EMA, but it was almost unknown for EA, the European Environment Agency, and ECHA, totally newcomer in the area of resistance, what they were doing and what we are doing. So a few months ago, we received all the agencies a mandate to establish this working group. And we have on our table now a number of tasks and responsibilities. One of the most important ones, in my view, is to early on be able to discuss the terms of reference for new mandates. And we learned the hard way. There was a recent report on antifungal resistance, on azole resistance in Aspergillus fumigatus that was sent to all the agencies, and it took almost 6 months to agree on what to do, and another 3 or 4 months to get together and agree on the practical principles to deliver a single product. So that was already a learning exercise that perhaps if we would have talked about it before and have an instrument, it would have been much quicker and better. The elephant in the room, we talked about this for a long time also in these 3 days, is the integration of surveillance data. Only if we understand the different types of data each agency is gathering, we can think about whether they fit together, whether we can do something together with them. So we are starting to bring these discussions there. Of course, to coordinate on communication activities. Again, a no-brainer. You have seen the huge amount of things that JAMRAI is doing on this, and we would take good note of that and knock your door and reuse and try to make the most of what is available. We are also very often contacted by projects like yours to be on advisory boards, on stakeholder forums and things like that. And we tend to be isolated. Sometimes it's EFSA, sometimes it's EMA, sometimes it's ECDC, sometimes it's the 3 of us, sometimes it's EEA. We not often have the opportunity to coordinate, to talk each other about what we are going to say. Like we had the first meeting happened last Friday in Parma. We talked about what to say here. There was Carlisle, there was ANSES. So it is nice to come already with an idea of this. And then, last but not least, is the external engagement. So we have A1 colleagues as observers in that group, but we have also been given the freedom to involve people from WOAH, FAO, WHO, as we see fit, depending on what is in our plate. And perhaps also one of the most important things is that now there is one single point of entry for all the agencies at the same time for any issue on AMR. So if you ever need to approach the agencies for that during these first 18 months, please contact me. Then there will be a rotating mechanism and agencies will take over each other. So that's, I think, is a very nice thing. We have a couple of people appointed per agency, and that makes communication much simpler. Also for us, because we have a more united voice, with our management, we hope that we can make a difference, and with Commission by channeling a single voice. So this is a bit the vision. We just started, so be patient, but we hope it will grow into something good.
Okay, thanks. Thank you. I have another question for Dora. Dora, you know, FAO is now running an in-farm program for surveillance of AMR at international level in both healthy and diseased animals. So could you tell us a bit more how you envisage that ESVID could maybe feed ITFARM, hopefully in the future? Thank you.
Thank you. Yes. So INFARM, for those who haven't yet heard about it, is the international FAO monitoring system for AMR. And it's quite a new platform. It's a global platform for countries to collect, analyze and visualize their AMR data from livestock, aquaculture, and also food products, but also to collect data from plants about antimicrobial use. So it's a very ambitious platform, and eventually the goal of it is to provide data into what we call the GISA, the Global Integrated Surveillance System for AMR and Antimicrobial Use, which is being established by the quadripartite, so WHO, WOAH, FAO, and also UNEP. And this Global Integrated Surveillance system is going to gather data from WHO's GLASS, which is the database for antimicrobial use and resistance data in humans. It will gather data from WOAH's ANIMUSE, which is the database for antimicrobial use data in animals. It will gather data from FAO's INFARM, which, as I mentioned, will be the database for AMR data in animals and antimicrobial use data in plants, and eventually also environmental data from UNEP, which you will hear about in the next session. So the goal of the INFARM is eventually to provide data into this global integrated surveillance system and to be part of the global effort for One Health surveillance of AMR and AMU. And for the AMR data in animals, INFARM collects data from both healthy animals and also diseased animals, both terrestrial and aquatic. So it would be a great advantage if ERSVET data could be linked to INFARM, because also it would be very easy for the countries, or much easier for the countries, so they don't have to submit data twice, but we could do it between the agencies. And also just to mention that this is something that has been discussed also with EFSA. It has been a long process, but by now it has been agreed and managed that the data that is going to EFSA, the AMR data, is going to be transferred to INFARM. So I believe it's a great achievement, and also looking forward to have the same cooperation with the ERSVET. So I believe it's very important, and then eventually all this data will go to a global database to be able to see what are the global trends and to do comparisons also at the global level. Mm-hmm. Thank you.
Excellent. Thanks a lot. And maybe to complement this information, I have a final question for you, Anna. I know WOAH is quite active in the field of AMR in companion animals. So could you tell us a bit more how you envisage the future landscape of surveillance of AMR in companion animals?
Thank you so much, Lucie, for the question. So we recognize the importance of the changing role of companion animals in society. We more and more treat them as family members, and this is something that's not only in the European region, but we also see that the growing boom and pet ownership, for instance, in the Asian Pacific region and the Americas. So our memberships are asking for us to include companion animals in our strategy. So the working group on antimicrobial resistance has validated an extension of our MR strategy to companion animals. And we have also working with quadripartite organizations to include companion animals in the revised global action plan for AMR following a One Health approach. So companion, where members have the context in which the national context justifies it, they should include companion animals in the national surveillance systems for AMU and AMR. So that's the kind of thing that we're working on. We're also revising our standards for AMR particularly Chapter 6.8 on harmonization of surveillance systems, looking into inclusion of companion animals, so providing guidance, is a general guidance for our membership to consider how they can look at what are the relevant pathogens for companion animals and commensal bacteria, and how they should go about sampling companion animals to include in the surveillance systems. And furthermore, we're currently working with different partners on having a global situation analysis, like a report on AMR in companion animals. They should be coming out in 2027, because we recognize that most members don't have companion animals in their national action plans or in surveillance. We have a big gap of data globally on what's going on. We have scattered data from scientific studies, research, universities. They are looking at what's going on in terms of resistance. We have some very, very sporadic reports from colleagues working in practice from the Americas, as I mentioned before, saying that they're seeing multi-drug resistance in companion animals, and they're using carbapenems, and they're using last resort antimicrobials for humans in these pets. And, you know, in some of these countries in the Americas, you can get these drugs off-label. So you just go to the pharmacy and you don't need a prescription, they just buy them. So this is a very big issue that we're dealing with, and we need to try and start looking at what's happening in companion animals. But we're very happy. So some countries are really being very forthcoming. So Resapat in France, they're starting to have data, so you can see that they're monitoring ESBLs and other resistance bacteria, and we really are welcoming this kind of information. And we have the UK is also starting, it's not EU, but the UK and European region, they're also looking at companion animals. So where the data, if you have that data, it will be important, but of course you need to engage the private sector, because there is where you have the veterinary, it's not covered by veterinary service, so that we need to find system. And I'm happy to hear from yesterday's keynote speech that the electronic systems, for instance, in Portugal, they get the data from EMU, but then we need to see, for instance, how do we get the data for AMR, because often that's not on the it's not easy to capture from electronic systems. So I'll stop there for the sake of time, but thank you so much.
Excellent. And so now it's time to close this session. I would like to thank all panelists for being with us today and taking the time to share their thoughts on how our JAMRAI deliverables and products can help. A few concluding remarks before we move to the next session. Well, we heard that from our external stakeholders that Europe should be, or we aim to be, at least a best practice region. So, the pressure is on our shoulders. At least I remember that external people are looking at what we're doing in terms of products and deliverables. But they're also happy to provide support. And there's three kinds of support I heard. One is implementation, the second impact, and the third one is sustainability. For implementation, we have here partners and stakeholders that have access to people working on the field, either in Europe or outside of Europe. For this implementation to happen, I think we need to have a very clear message. So we need to align our definition and guidelines to those already existing. There is no need to reinvent the wheel. And I think we also heard this from the previous session in the human sector, that that's one important message that we want to have. The second one is the feasibility. So maybe, okay, we're a best practice region, but we need things to be feasible and applicable. There are important considerations in the animal sector, like economic impact that you mentioned, I think is an important one. And for this feasibility to happen, we also need education and training. The second one, impact. There's been a lot of material developed, especially by the communication team, and I'm happy to hear that some stakeholders have already engaged into disseminating those products and making them visible, for example, the WOAH. So thanks a lot for this. I think it's important to recognize that if the Europe aims to be a best practice region, outside of Europe there is still a lot to do, especially in our animal sector, when we talk about AMS, biosecurity and so on. So we want to make sure that the products we are generating hopefully can have an impact there as well. And the third one, the sustainability. Well, it's a main challenge that we have identified, we know, including especially for ESVET and our surveillance activities. And I'm glad to hear that, EFSA is willing to support us to try to find areas and how hopefully EFSA could get a mandate to try to sustain this and make sure that all the work we've been developing here, like databasing, pulling this network together, producing guidelines, like it's not going to be finished in 2027, but hopefully it can be, sustained beyond JAMRAI 2 because there is a need for it. We heard this from different stakeholders, being either for risk assessment, for stewardship. There's quite a big gap on AMR in animal pathogen, and it's something that we want to, further develop and hopefully sustain beyond the JAMRAI 2. Okay, so with this, I will stop here. Thanks again, everyone, for coming all the way here, and happy to collaborate again in the future. Thank you.